96.3 WHUR. This is the Insight segment. Your questions or comments at 202-432-WHUR or toll free 1-800-221-WHUR. Now, Insight.
Welcome back. This is the Insight segment. I'm Harold Fisher. The death of the king of pop was ruled a homicide yesterday. The L.A. County coroner report says a deadly dose of the drug propofol caused his death. Jackson's personal physician, Dr. Conrad Murray, has been under scrutiny since Jackson's death. He admitted to administering the drug and many others to the pop star. Murray was with Jackson when he died, but there are still a lot of questions surrounding what is now a criminal case. Well, joining me to talk about this is Howard University Hospital anesthesiologist Dr. John Herbert and criminal defense attorney Leonard Long. Neither of these men are involved in the Michael Jackson case, but if you want to comment or if you possibly have a question, you can give us a call right now at 202-432-WHUR. That's 202-432-9487. Outside the local calling area, give us a call at 1-800-221-WHUR. Gentlemen, thanks for joining us.
Thank you. Happy to be here.
Oh, thank you so much. You there?
Yes, you
are. Okay. Okay. Well, let's get right to it. First of all, I want to talk about some of the medical details first. Dr. Herbert, we've heard quite a bit about this drug called propofol, but please give me a quick thumbnail sketch of what it is and how it's used.
Okay. Propofol is a general anesthetic induction agent. That means that this is a medication we administer to put someone to sleep, to anesthetize a patient for a surgical procedure. It's given in combination with other medications to achieve the same effect.
So when you're in the operating theater and you give this one to, in layman's terms, put them under, is this sleep as we know it? When we, go and try to get our 6 or 8 hours at the end of a long day of work, or is it something more than that?
It really is something more than that. When you anesthetize someone, you render them insensitive to the pain and memory of a noxious stimulus. So if you're having a gallbladder taken out, yes, this is wonderful sleep. It's the blessed ether, as described by Queen Victoria in the 1860s. Mm-hmm. It is appropriate for a medical procedure, for a painful procedure, for an obnoxious procedure that you don't want to have recall of, but it is not appropriate. It's not the same as going to sleep.
And there are reports of other drugs that that Dr. Murray has administered to Michael Jackson but before his death, something called lorazepam. Forgive my lack of ability to pronounce this. You need a medical degree just to pronounce some of these things. Midazolam. Is that a?
That's correct. Midazolam. Both of those medications are so-called benzodiazepine medications. Mm-hmm. These are the classic one that most people know is Valium.
Right.
Valium is the little yellow pill. And if you take a Valium, yes, that will give you some release of your anxiety. It'll make you a little bit calmer. It may actually allow you to go to sleep. Lorazepam and midazolam are also are similar medications in chemical structure, but they're used differently in the hospital.
When you heard the report that Michael Jackson had many of these in his system, but that his death was actually caused by a deadly dose of propofol, from your expert opinion, or at least what was your reaction at first?
My first reaction was one of horror. How could someone use this medication as a sleep medication? But then most people wouldn't know the risks, benefits, and alternatives to a medication. If you have a patient who is demanding something of you, you really have to stop, assess the situation, and recognize what's in the patient's best interest.
Like any other doctor, I would imagine. You ask your doctor, well, doc, I need this because I don't feel well, and the doctor should know that, well, maybe you need to try this instead of that or something like that.
Right. Most of us familiar with the use of this medication, and I must say that anesthesiologists use the medication propofol on a daily basis for patients, and we recognize the risks inherent in administering that medication and the precautions that you must take in monitoring a patient very carefully, and the dosage and the interaction of other drugs which can have a deleterious effect on any human being.
Attorney Long, a criminal defense attorney. First of all, before I go into my questions, how long have you been practicing?
25 years.
So you know what's going on in a criminal courtroom.
I'd like to think so.
Okay, so we know that Dr. Murray, he hasn't been arrested, he hasn't been charged, he really hasn't been named as a suspect yet. So far, he is the only person just named publicly in this case. If charged, what would you imagine the charge to be?
I think the lead charge might be that of manslaughter. Then perhaps having to do some charges having to do with the administering of the drugs and the if they were prescribed, things of that nature.
Mm-hmm. Now, why manslaughter? Because the first thing those of us in newsrooms around the area, I would imagine those who don't have lawyers in the newsroom, you hear homicide, the first thing you think murder. And yet, Dr. Murray was the last person to see him alive, according to these reports. He attempted to save Michael Jackson's life, according to the 911 tapes. So why would they call this a homicide?
Well, a homicide is simply the killing of, is defined as the killing of one human being by the act of another, by the act or omission of another. That's homicide. Mm-hmm. But when you're talking about murder, you're talking about premeditation, that you intended to do the act. That is to say, one intended to kill by his actions. But in terms of manslaughter, that is an act without premeditation that causes the death of another.
So you're suggesting that it's quite the reason that he may, if charged, get a manslaughter charge is because his actions don't at least appear to be malicious.
Yes, that's what it appears, based upon news accounts, that's what appears to be happening.
Now, if you were his client, if he were your client, you know he did a video last week, and it was released on YouTube, and it was played on all of the networks. Would that be the kind of thing you would advise your client to do?
No. First and foremost, I would have never allowed him to talk to the police in the first place.
Why not?
And at this point, because he was the last person seen with who is said to be seen with Michael Jackson. He was actually a suspect or an interested person from the very beginning. Now that he's gone on video and trying to explain himself, I would advise him to shut it down and shut it down quickly.
Mm-hmm. Now, but from, I guess, in the court of public opinion, some people would say, well, why can't he talk to the police if he doesn't believe he did anything wrong?
Well, because now he's subject to a criminal indictment. Mm-hmm. And certainly the people will keep their opinions. But now when he enters into the court of law, the onus is upon the prosecution to prove beyond a reasonable doubt whether he committed manslaughter, whether he committed any of the acts that they're going to charge him with.
Dr. Herbert, let me go back to you for a moment, because something just occurred to me. To your knowledge, is there any other use for propofol other than in an operating theater?
Well, yes. Propofol can be used as a mild sedative medication for a dental procedure, for an endoscopy like a colonoscopy, where a patient isn't really put to sleep, but they're allowed to be in a relaxed state where they're allowed to be able to cooperate with their physician, but also will have very little recall of any noxious stimulus.
So would there be any need for any reputable doctor to use it outside of a clinical setting?
Outside of a clinical setting, I'm not aware of that. I've been doing anesthesia for 30 years, longer than propofol has been with us. Mm-hmm. And I can't imagine a use such as the alleged use by these individuals, especially in combination with the medication that was given before.
And certainly not in a home setting, I would imagine.
And, well, a home setting, if a home setting were outfitted like a colonoscopy suite, like a doctor's office, with appropriate monitors, and you were scheduled to do a procedure in someone's home, I could see that. I really could see that, as long as all of the safeguards were there and you had a professional administering the medication, and hopefully an anesthetist, an anesthesiologist, an anesthesiologist assistant, someone with the skill, the training, who can recognize, diagnose, treat, and correct any of the problems that would result from the administration of an anesthetic.
There's a reason why I'm asking this question, but I need to take a break. I'll be back.
Energy hog the team. Infiltrate the house and waste some energy.
No problem. It's got leaky windows and no attic insulation.
Perfect. Now go wild and waste some wattage.
The Mitchell House. A house like many others, except this one's under attack by energy hogs. They show up anywhere energy's being wasted.
Talk to me, hogs.